So it is shoulder week and we are on video number 2. Today I'm going to show you some of the stretches and exercises that you can do to reduce your shoulder pain. Again, if you remember in the first video, we talked about shoulder pain in the front of the shoulder, on top of the shoulder, and behind the shoulder. And these pains happen for various different reasons, whether it's tightness in your biceps, your pec, tightness in your upper trap, or pain, inflammation, or tightness of your rotator cuff muscles. So we're going to go over some stretches that you can do with things around your house to reduce that shoulder pain. So the first stretch I want to show you is an internal rotation stretch for your shoulder. All you need is a beach towel, a belt, or a stretching strap if you have one. I have a gait belt. All I'm going to do is put it right over my shoulder. I'm going to let that drop down. I'm going to reach back with my opposite arm, and then I'm going to start pulling this part down and this part up. I'm going to feel a little bit of a stretch in the front of my shoulder. Now, as you pull it up, if it gets too painful, obviously drop it down a little bit. If it feels slightly uncomfortable, I want you to get to that point where it feels slightly uncomfortable, and then you're going to bring your shoulders back, your chest forward. You'll feel a little bit of an intensified stretch, and I want you to hold that for about 45 seconds to 60 seconds, 3 times. The stretch I want to show you for the front of your shoulder to stretch out your biceps and your pec muscles is the doorway stretch. So you just get into any doorway, put your arm on each side of the doorway. I want you to lean forward. Now, a good tip is to reach down towards the ground. You're going to feel more of a stretch through your chest and through your biceps. The next stretch I want to show you is going to look really familiar. It's going to come from week 1 when we were working on stretches for the neck. It's a stretch for the upper trap. Now again, if you remember, the upper trap goes from the bottom of your skull out to the outside of your shoulder. That's where it inserts. So what you're going to do is put that arm behind your back. You're going to tilt it to the side and you're going to pull down. Okay. Again, you might feel it in your neck and you might feel it all the way down to the outside or really the top of your shoulder. And that will help with some reaching overhead. If you have a pinch right on top of your shoulder and you feel like you can do a lot of other things with your shoulder, but when you reach right overhead, you feel that pinch. It's probably because your upper trap is getting involved, and then you feel that tightness in your upper trap and that pinch. So try the upper trap stretch, and it's going to help you reduce some of that pinch that you're feeling right on the top of your shoulder. So the first exercise I want to show you is for the front of your shoulder to build up that anterior deltoid muscle right there in the front. So what you're going to do is grab a TheraBand. You can grab a free weight, and all you're going to do is lift your arm right in front of you. Now, what I don't want you to do is to keep your arm directly in line with the side of your body. I want you to turn that hand out about 15-20 degrees and then lift it up. This is going to open up the shoulder a little bit, and it's going to reduce any pain you might have by just lifting it straight up. Now, the second thing I want you to try to recognize or look at is when you bring it up and then you start to bring it down, do you feel an intense pain in your shoulder? If you do feel an intense pain in your shoulder and you feel like it's just dropping, that could be a little bit of a different issue, and feel free to contact us and we can try to walk you through what might be going on. A lot of times when you bring it up and then it just drops down on you because it's so painful, it could be indicative of a rotator cuff tear, rotator cuff inflammation. Maybe it's not, but a lot of times when we see a lot of pain right when you're doing eccentric motion, which is when you're lowering it down, a lot of times that is indicative of some kind of rotator cuff involvement. So the next exercise I want to show you is still with this resistance band. Now we are going to work on the infraspinatus rotator cuff muscle that sits right on top of your shoulder blade and attaches to the back of your humerus. What you're going to do is grab your TheraBand. It's connected to the door. I showed you that little knot that you can stick in the door, close it, and it will stay. It will not pop out and hit you in the face. What you're going to do is put your elbow right by your side, hold your elbow at a 90-degree angle, and then pull that TheraBand out to the side into external rotation. Now this is going to strengthen your infraspinatus muscle. After you do enough of these, you might even feel a little bit of a burn. That's fine. It's just the muscle fatiguing. Take some rest breaks. You should do about 20 of these with a 3-second hold to build up that infraspinatus rotator cuff muscle. So the last exercise I want to show you is a more dynamic movement. It's a lot like the one I showed you guys when it came to improving scapular strength to reduce neck pain, just slightly different. Now this one is going to give you a lot of bang for your buck for a very easy movement. So what you're going to do is keep that TheraBand in the door where it's about level with your waist. You're going to bring your arm up just below shoulder level. You're going to hold it right here. You're going to bring your arm right to 90 degrees. So 90 degrees at your shoulder, 90 degrees at your elbow. You're going to bring it down. You're still going to feel a force pushing you that way. And then you're going to pull it up over your head. Now you're going to do this about 3 times. You're going to bring it back here to the neutral position, back down, and that'll be your resting position. Now you're going to feel your shoulder burning in a variety of different places because this is activating tons of muscles. It's activating the front of your shoulder. It's activating some of your rotator cuff muscles on the back. You're doing a lot of dynamic movement. So if you're feeling a ton of pain with this, don't do this one. Do some of the other exercises and then maybe even go back to the stretches before you do this movement. This is slightly more dynamic for someone who wants to try something a little bit more difficult to really test their shoulder. Now, of course, these are only a few of the stretches and exercises that we would do if we had a patient come into the clinic. There's obviously a ton more that we do, but if I were to fit that all in one video, it would take forever and it would be hard to find really finite information to help the majority of the people. So if you want more specific information about your shoulder issue in particular, please just contact us, message us, text, call, email, and we can answer your more direct questions about your shoulder pain. If there's something that you're worried about, you can contact us.